Good morning and welcome to our latest edition of Between the Lines Live here with Ray White Commercial. Today I'm sitting up here in sunny Brisbane and joined by some Queensland colleagues here today to talk about all things medical. So first up I've got Franz Stapelberg, and he's our medical specialist that works here at Ray White Commercial, and we're joined by a developer as well. So thank you so much for joining us, Simon Rogers.
Pleasure to be here.
Simon is Director of Rogerscorp. So medical is an industry asset class that everybody's talking about. They've been talking about it for a little while now. I suppose COVID brought it to the surface more so than it probably already was before. So lots to unpack today, but I'll start with you, Simon. Do you want to tell us a little bit about what you guys do? And I understand you work here in South East Queensland.
Yes, at Rogerscorp's property development company. We undertake projects in the healthcare, childcare and residential space predominantly. Just around southeast Queensland.
Exciting stuff. Well, it's been a really busy time for you. There's a lot of new developments going on, a lot of new types of medical assets being developed. So we'll kind of jump into that. But before we start, let's just kind of the state of the healthcare market here in Queensland in particular. Where do you see it being in terms of the asset class?
I think medical is a very high sought after, not only an asset, but also just the demand itself in healthcare is increasing, and due to multiple different factors as well. Aging population, of course, is the big one. But the demand is very strong, I think, across all of, not just Queensland, but across all of Australia. I think we still only in the crux of the upper ramp, as they would say.
Yeah. I suppose also, particularly for Queensland, that kind of population growth and the migration that's come from other states to Queensland, particularly over the last couple of years, has probably seen that demand ramp up even more.
So Australia's, I guess, got high international immigration compared to the rest of the world. So you've always got that underlying demand. Other public health sectors got its issues, which is, you read about in the newspaper, which elective surgeries and things back up, and that sort of helps prop up the private health sector as well.
I think before we probably kind of delve too much into it, I'd like to, I talk about medical a lot in my research because it is an asset class that a lot of people are interested in, but there's a lot of terms kind of flung around, like what's allied health and life sciences, and then there's medical. Can you give us a little wrap up of what are they all the same thing, or what are they?
So I think medical is broken up into three sectors. You got primary, secondary, and tertiary healthcare. So most people refer medical centres as your GP clinic, and that's actually what we would call the primary healthcare, and also preventative healthcare, because the whole point of the primary side of it is to either try and prevent chronic diseases management and anything in the sorts of helping a patient prior getting into the hospital, where if you look at your secondary sector is purely more specialised. So that would include your hospitals, your cardiologists, your allied health services, which is anything post seeing the GP essentially, and then your tertiary sector is very more specialised than that, which includes like your cancer care, anything that is more specialised after the hospital.
Okay, so where does life science sit then?
Life science is more research, so clinical trials,
laboratories,
the laboratories,
and is
research.
So that's a different sort of asset, if you like, to that kind of primary, secondary, tertiary type facility.
Correct. I think it's together, but it's also separate. It falls under like healthcare, but it's predominantly more bioscience research focused.
Okay.
Where the drive for healthcare at the moment is the primary, secondary, and tertiary.
Okay, so looking at that primary, secondary, tertiary, which is what we probably in the commercial property industry, we kind of term medical like loosely. It covers those kind of areas. We've seen some developments happening, developments in development, so some changing in the way that new assets are coming to the market and what those assets are, being these kind of integrated health facilities. And you've done a lot of those developments, Simon, so can you talk a little bit about what they are?
Yeah, so we're, you're right, we do have got two of those projects underway at the moment. So they're essentially the whole healthcare ecosystem in one building. So we start off with the primary healthcare, we've got the GPs, we tack on the secondary healthcare as well. So diagnosis specialists, and then there's day hospital for your procedures and everything. So you can go to the hospital as a patient and have that full integrated experience, and see all your specialists in one go.
So it's a one-stop shop, if you like, for your medical needs.
Essentially, yeah. It's about making it more convenient for everybody, helping all the tenants get referrals off each other, and stimulate each other's businesses. And
that kind of the rise of the day hospital is something that we've certainly seen over the last little while. Do you have anything? What can we learn about that? Because there's way more day hospitals than there has been in the past, and there's been development of those.
I think in our experience, we're starting to see as healthcare technology is improving. A lot of these procedures don't have to be done inside hospitals anymore. A classic example, a trending example, is orthopedics. So usually in orthopedics, it had to be done in hospital. Technology is getting better, so they can do certain procedures or starting to do certain procedures in a day hospital setting where the patient is only there for the day, gets the procedure done, and the post rehab is done in home. So it's a new trend, and I think a lot of new as technology evolves, new surgeons or new specialties will also start utilizing those facilities.
And given that these integrated facilities have the day hospital as well as those kind of allied health and your primary users, to build an asset like that, is there differing levels of requirements, or are they all the same?
100%,
or is it,
yeah. So when you start getting into the Class 9A use, which is just your National Construction Code, so that inherently brings with it like larger fire stairs, like increased slab thicknesses, increased acoustic requirements for your glazing. You need medical gas rooms, larger lifts to accommodate your hospital, stretcher beds and things like that. You need backup power generation. So a lot of things within the building that a traditional, say, office building or that doesn't have.
So you mentioned the office building, so that's kind of an interesting one. So we hear a lot of kind of adaptive reuse of existing assets into medical. How real possible is that then if they don't have that kind of level of sophistication around the actual building? Does it depend on the use, or
it does depend on the use. So a lot of your primary healthcare uses, like they can fall under a traditional office environment, being Class 5 under your NCC, which doesn't sort of trigger these requirements. But as soon as you start getting into more medical procedures happening on site and ambulant patients, then you start to need ambulance drop-off bays, your larger lifts, backup power generation, and those sort of.
So, Franz, with these kind of larger integrated assets that, if you like, how are they then? Like, do you develop these and then are they on-sold? And are they on-sold? They cut up into strata, or are they sold as a one unit, or is it all different? Or?
Yeah, I think there's it depends on the outcome. I think there is a lot of traditional REIT funds are after healthcare assets, especially. It just depends on how the original building was designed. But they can be strata, and the reason they do the stratas is for specialists to buy into the building itself or on their floor as a consulting suite. That sort of makes the rest of the building sticky or investment sticky, just for keeping activity in that location, because generally healthcare operators don't want to move around. No. But we are seeing a big shift of REIT funds and also international capital attracting to Australian healthcare property and in the asset class itself. And I think there is a lot more transactions happening. They are purchasing and even the yields which it's driving towards in the sector, it makes a very big different outcome.
Okay, so you talked about yields, so we'll get to yields, but I suppose that if you're talking about REITs or foreign buyers coming in, there's a certain size that they're only going to buy in. So they're buying those kind of larger integrated facilities which has the hospital in there, and as well as those kind of other units. Whereas those assets that are then cut up into the strata, so they're owner occupiers, what you're seeing a lot of those are on-sold to those end users.
Yeah, correct. Yeah. And that's a lot because the specialists are putting it in the self-managed super fund.
That's right.
That makes it a good outcome or a tax ability for them to operate.
Fair enough. And with the REITs that are buying, looking to buy these sort of assets, and also the offshore money, I suppose they've invested in kind of larger funds in the past, like larger healthcare funds, and they've seen Australia having a good track record in terms of returns. Is that fair to say?
Yeah, and I think in the world, if you look right now, there's only a handful of locations you can invest in, which is quite stable. And Australia being quite up there, I think in number 3 or 2.
Yeah.
And
Yeah,
it's
for sure.
just been a defensive asset class with that underlying ageing population, strong immigration, the public health system sort of struggling to keep up with everything, mainly because of the government funding model, which is sort of just pushing demand to the private health sector. And you saw during COVID, like the government came in and underwrote the private health and day hospital sector and kept them going. And constantly with the backlog of elective surgeries in the public space, they all feed those out to the private sector as well. So, being a strong defensive asset class, and Australia being a great country, there has been that capital and a big influx of it over the last 5 years of REIT funds, popping up with and having large amounts of capital and trying to acquire these assets at scale.
So are these kind of larger assets? You want to put a call on what sort of yields they're kind of sitting around, or?
In the last sort of 12 months, we've seen some of these assets trade down even to in the low 4s. Right now, with interest rates moving up, I think we've seen them move to anything between 5.5% and 6%. Some of them even going to 6.5%. But it's purely based on as well how the asset class, who's the tenant, what's the tenant covenant, how is it primary and secondary all together, and I guess also size, because the larger you get, the more interest there is from the larger capital funds, and they also know that they're buying it for growth over the next 10 and 20 years.
So how about for a private investor? So we've seen a lot of private investors kind of jump into the medical space, broadly, loosely kind of termed medical. So that might be a smaller medical centre or a, suites. Because you said owner-occupiers are the main buyers, but I'm assuming there's quite a lot of investors also that will jump into those sort of spaces. Are we still seeing that? Like we did see it, sorry to interrupt you. We did see it particularly in the last couple of years during COVID, that kind of smaller price point, kind of attractive to a lot of investors, but interest rates moving, that may have changed. Are we still seeing that demand in that smaller end?
Yeah, we're still having assets right now, which is sub 10 million, where they are attracting a lot of private investors. And also some of the larger assets are attracting private family offices.
Okay.
So there's definitely, I think the private investors have seen that the medical assets is a good investment over just a long term as well. It's not just short term. And it'd be exciting to see how it grows even further.
And yields probably similar sort of thing. Do you get a or depending on the smaller sizes, the smaller price point, does that make the yield lower or does it make the yield higher? Or does it depend on the asset, I suppose?
They do stay sharper. The smaller assets, especially the sub 10 million assets, they seem to attract, your smaller private groups, and they're less susceptible to interest rates, whereas your larger REITs are more reliant on borrowed funds so with the last environment, the last 12 months, it has affected yields at the more at the institutional level.
And so if these are bought by an investor, obviously there's a tenant having to come into these facilities. And is there a big demand by tenants then? So that would be your doctors or your centres, or I don't know, who are the tenants for these assets? Are they the individuals or?
So in the past, it used to be just corporates, I think, expanding and opening more centres. But I've seen a big shift in the market where a lot of privates or general practitioners or just specialists moving from a public sector into the private sector and starting to set up their own clinics for the first time. So they're very driven because they also know they want to do quality healthcare. So they usually are signing long-term leases as well. But that's the sort of shift we're seeing. It's going from corporates to privates, and it's very much relationship driven in the healthcare space as well. I think with tenants, I think if you can show them what growth and outcome and suburb demographic is available, they tend to move into these suburbs and provide a quality healthcare for the community and everyone else around.
Yeah, that makes sense. Like, it's not just this much space determines this sort of rent. It's really depending on what is the support services around, what is our demographic. If it's an area that has lots of kids, and if you're providing paediatric services or something like that, all of those kind of demographics feed into your ability to pay your rent, obviously. So, how much you're willing to pay. Yeah. And you have incentives. Is incentives even a thing in medical?
Yes, I think incentives are higher than your typical commercial building, but that's also due to the extra or the features of the building that needs to be included to make it a proper healthcare facility.
Yeah.
So there's a lot of things that are not in an office building or typically in an office building. Putting a bed stretcher in there, a bed stretcher lift, or a backup generator generally is not common.
Yeah.
And all that has extra costs as well. And I feel like when you mention the word medical, prices just increase by 10 times.
Probably.
Yeah.
Well, and also our whole construction cost issue at the moment, as you are aware, is just it's a whole nother kind of ball game, which makes it hard for you to, in your developing of assets and making it kind of stack up.
Yeah, 100%. So over the last 18 months, I guess there's been a rise in construction costs. Over the last 6 to 12 months has been the softening in yields, so it squeezes you as a developer at both ends. But at the end of the day, if having resilient tenants and good tenants in a resilient asset class, does lay some solid foundations for.
And I suppose that
for developing.
But there's also that kind of roadblock that we've got in terms of planning. I can imagine site identification. Which is probably all stuff that you both are dealing with all the time, is quite difficult. And so we're understanding that we really do have an undersupply when it comes to these kind of medical facilities. That's why there is such this swing to private, like you said. How are we going with kind of trying to close that gap in terms of new development and site identification, and how the planning process is going? Because we know that things can get stuck in planning for an awful long time.
Yeah.
So zoning does get a little bit tricky with hospitals. And you've seen there's been a rise in just state people going via the state government for applications instead of via local council, just simply for the fact that there's a need there. The facility doesn't tick all of the local government planning regulations, so they sort of go via the state path to get the DA across the line. So that's fairly common in the hospital space. And also, you start getting issues like with car parking and things like that. So if you're doing more in a city zone, there's actually a maximum amount of car parks you're allowed, not a minimum. So it might be one car per 50 square metres, which in a facility like this, your surgeons and your specialists and your patients aren't really getting public transport to go there.
Yeah.
They all want to drive because they're either sick or they're a surgeon that might need to whip out to go to a hospital or an emergency. So they don't rely on public transport, so trying to sort of get that past council that you want more cars in there than what they want. Yeah.
And I'll also maybe mention there's certain key drivers. I mean, it's very easy to say you just want to convert a commercial building into a healthcare facility, but there is key drivers for tenants and operators that. In our experience now in the last 10 years, we've sort of identified and know now a little bit more about what those key drivers are, and you can't just open up. You decide you're going to change an asset into a healthcare. There's certain demographics that it has to tick the boxes now. There's also specialties that they require around it, and so it's also knowing how to put these assets together rather than just saying, all right, we're going to change it into a medical facility.
Yeah.
And onboarding tenants is a lot different to a traditional sort of commercial or retail lease. A lot of it involves actually piecing together the operation and helping them establish their business as well, and providing some support in different areas, which
and we spoke a lot about this kind of these specialties. Is there a specialty like, I don't know if there is or not, but is there uses that are more kind of growing more than other? I'm thinking kind of cosmetic, sports medicine. Is there more of those, or is that always just been a thing? Is there any one use, like you're getting more inquiry from different tenants, or
I think
you're
the
seeing...
three trends is sports medicine is one. I think that's sort of up and
Yeah,
down.
we're all going to gyms. I'm not, but people are going to gyms and they're hurting themselves, so they need sports medicine. Well, we've definitely seen that grow.
I think psychiatrists in private mental health hospitals is becoming a large trend as well. And I would say cosmetics are probably also happening.
Yeah, I mean, there's some of the REIT funds and people like that don't favour having...
different uses.
Yeah, or some like beauty services and things like that. Like they sort of disregard those as healthcare. But certainly plastic surgery and things like that are certainly a growing asset.
And I suppose
specialty.
with the kind of growth in the elective surgeries as well.
Yeah,
that comes into play to some extent, I suppose.
Yeah, and I think that's probably the one of the key drivers on why there's the demand for healthcare. Because if you look at just across all of Australia, the backlog between elective surgery in the public space, it's just the government can't keep up. I mean, if we just take Queensland and Melbourne and Sydney, for instance, I think Queensland's already behind 176,000, which backlogs more than 6 months. And that slack needs to be picked up at some point as well. And Sydney, Melbourne is about to double their elective surgery by 2030. So it'd be interesting. That is one of the big drivers in the private sector.
Well, that's why we're seeing this kind of move to these larger facilities, these day hospitals, and these one-stop shop, if you like. Well, because it's a need. Like there's this massive shortfall, and it needs to be attended to, I suppose.
Yeah, so we just see a big shift. From some centralised large hospitals shifting out into a lot more just day hospitals spread geographically, so it's easier to get to. Just a smaller, nimble private operator can perform surgeries a lot cheaper than the larger sort of clunky systems. You get sort of better level of care and so that's just sort of the rise of it. And I think the sectors like private day hospitals, I think, represents just over 50% of the actual private hospital sector. So, and then just the day hospital sector's growing at 7% per annum or something like this. So it's strong growth, and we just see it, pulling away, which does alleviate the larger core hospitals for emergency procedures, and it sort of takes all the acute and elective procedures out away from the system.
And one of the other things you mentioned about was this whole the well-being and mental health. That's something that we've seen, a spotlight on, particularly during this COVID period and post it. Have you seen a kind of a greater push by your tenants or your occupiers? Are you seeing more of these facilities?
Yeah. So I think COVID has sort of definitely opened up the eyes of healthcare and taking care of yourself and mental health now as well. And there is a lot of private mental health hospitals in the pipeline. I think across just all of Australia, but especially for Queensland. And I think the stigma around the mental health is also dying down, which is great to see. And these facilities are going to sort of help anyone with anxiety and eating disorders and everything else as well. So it's a good community service as well. Yeah. And it's great to see even private health insurance companies getting on board and including that in their private health insurance.
And I think you had a development of like a veterans
at
wellbeing.
Stafford, so we've got a veteran health hub there. So that's got two tenants, being RSL and Department of Veteran Affairs. So both of those tenants providing the Open Arms program and Mates for Mates program from the facility. So that's all about physio rehab, psychological services, wellbeing services for the returned veterans. So the suicide rate in the Defence Force is a lot higher than your general Australian population, and there's been the Royal Commission into it lately on suicide in the Defence Force. So I think Australia's lost more people. Australia's lost more deaths in the Defence Force to suicide over the last 20 years than they've actually lost in service in Iraq and Afghanistan.
Oh, wow. So these sort of facilities
it's an alarming statistic,
These facilities are, very much needed in the community then.
Yeah, and the tenants, like both our tenants programs have just had massive uptake, and they're just on a huge growth path, trying to roll these things out. And
so I think there's a lot to actually unpack in this medical place, and I think I'm cautious that I think we could sit here and chat for another half an hour, but we're nearly coming up to time. So I'll probably just put it to you, if you could. Well, I think we've already kind of identified what the opportunities are. There is this huge demand still, given this shortfall you said in kind of elective surgeries, and people just being able to access medical facilities of all types, from the specialised to even just GPs, is a bit more difficult to get into at the moment. So what do you see is, I suppose we don't have enough doctors, and that's another piece of the puzzle. If we build these facilities, all great, but can we staff them? Staffing is a major issue across
everywhere.
And I can imagine that for medical, it's probably even more so.
Yeah, I think especially for primary care, the GPs, it's really tough on them as well, because I think there is a big shortage, just not just regional, but also just across all of Australia, and then major cities. And now the move between bulk billing to private billing, because of the Medicare rebate has been an issue.
So can I just understand the Medicare? So has that rebate just not changed the dollar amount for quite some time? Is that the kind of issue, and that's why we've got this shortfall in trying to find a bulk bill doctor is like next to impossible?
Yeah, or they extremely booked out for the 6 weeks.
Yeah.
But it is the Medicare rebate has just been frozen for the last, I think it's more than 10 years now.
Yeah,
and the cost of everything and inflation has pushed up, and a doctor can't do the same procedure, for the same price anymore that it did, 10 years ago. So, and the staffing is an issue. I mean, until the government can also step in and start making it slightly easier for trained specialists from, UK, America, everywhere around the world to come in to sort of alleviate that issue. It's also another sticking point.
Yeah, for sure. But let's just wrap up on the point that, so commercial, not commercial, but medical assets, whatever you want to call them, allied health, life sciences, all those sort of things, really still an attractive investment asset class, likely to remain
100%.
so. Like the demand is not going away. Our population's growing, our need is increasing all the time, and there's only so many of these assets. Like we can't kind of develop them quickly enough, or staff them quickly enough either. So the demand will stay.
And they're more specialised, so your tenants are more sticky, and it's a tailored building.
Yes. So it's not necessarily one that you can quickly move from an office or retail to a medical. There's all those kind of planning and building things that go along with it. But if we need to identify sites and things, hopefully we can kind of move in the way that they can be redeveloped. But the prices are pretty high at the moment, aren't they?
Yeah, but I also think that the sector will become a multi-billion-dollar sector.
100%.
We're only at the start of it.
Well, once you see all this funding coming from offshore and those big REITs getting involved, like it's an asset class. They see it as a long-term investment play. They've received great returns over the last few years in the existing funds already out there. So. Once they're here and they're growing, it's the place to be. So those private investors that are out there and been looking at medical centres and all medical assets of any type are, you're onto a good thing.
Yeah.
Anyway, so I think that we'll probably wrap us up for today. So thanks so much to Simon and Franz for joining us, talking all things medical. Hopefully that answers some questions. I didn't know what some of those terms were. So thanks for joining us, and there will be another Between the Lines Live coming next month, so watch out for what that is, and we'll be looking at, in particular, the building and the development space, so watch out for that one. So thanks so much.